I'm doing great, and you guys?
Good.
Very well.
Absolutely. It's a beautiful morning out there for sure. We are talking PRK. What is PRK?
Well, PRK is one of the two types of laser vision correction surgery. It's probably the lesser known versus LASIK, but it's actually the predecessor. It's like the parent to LASIK.
Really?
It was developed prior to it. And the differences between the two are LASIK, if you remember Dr. Graham a couple weeks ago talking about cutting a flap, lifting the flap and treating with the laser. This one's a little bit more simple. We remove the top layer of the cornea, and then we treat with the same laser that we use for the LASIK. So the benefits of this versus LASIK are you don't have to cut that flap like you were talking about, and it's technically safer. It does have a little bit longer recovery period as far as the vision and maybe a little bit more discomfort, but it's a safer procedure. It's a cheaper procedure to perform. At about 6 months national average, the vision was actually about the same. About 96 to 98% of patients are 20/40 or better without glasses. So it's still a really great procedure. And patients, there are some patients who don't qualify for LASIK who do qualify for PRK, like patients with thin corneas or patients with really dry eyes, which I think I'll also be talking about in a couple weeks.
Okay. Dry eyes, huh?
Yeah.
And thin corneas. I'll have to look into that. You said there's discomfort though. That's what I'm looking like. So what do you mean by discomfort?
Well, with LASIK, one of the benefits is that there's not quite as much pain, and usually patients just have a little foreign body sensation. There's probably a little bit more discomfort for about a day or two, but we do put a contact lens on to help the cornea heal afterwards and things like that. It's usually pretty mild and only lasts a couple of days, and then once everything heals in, there's usually no pain at all.
Good to go. If people want to find out more, how do they get a hold of you guys?
Well, we're at ralpheyecare.com is our website. You can call our office at 720-3553, or heck, you can just stop in and see us if you want.
All
Do
right.
that. Dr. Charlie Ahrens, of course, Ralph Eye Care Specialist. Thanks for stopping in today.
Thanks a lot.
7:36 here on the new morning show. It's NU92.